Good morning. My name is Tuve Rutendo and I am presenting on Pethidine. It is known as meperidine, brand name Demerol. It's also called a narcotic. A narcotic is a drug that affects mood and is also consumed for non-medical purposes. Other countries no longer consider it as medicine and may only be approved for veterinary use due to its cardiac effects and histamine release. Properties of pethidine. It is an opioid analgesic. It is classified by DEA as Stage 2 controlled substance. By Stage 2 controlled substance, we mean it is tightly controlled by the government because it may be abused or cause addiction. So, for example, if there are tablets, the number of tablets in a department is recorded on a daily basis. Its significant risk may exist in the elderly, patients with kidney dysfunction, and pediatric patients. It is an addictive sedative. It is also a toxic metabolite which produces normeperidine. Uses of pethidine. It relieves moderate to severe pain for which alternative treatments are inadequate. It is used as an adjunct to preoperative medications to reduce shivering. By adjunct, we mean it is added to the preoperative medications as a supplementary to reduce shivering because pethidine produces sleep or calmness to an individual. Pharmacology. It acts as a weak agonist of opioid receptors which creates sedation and analgesia. Sedation is a state of calm or sleep. Analgesia means it relieves pain. Its effects may be felt 10 to 15 minutes after ingestion. It lasts 2 to 4 hours in the body. It may cause respiratory depression and euphoria. By euphoria will mean experience of pleasure or excitement and intense feelings. Side effects of pethidine may include nausea, vomiting, lightheadedness, dizziness, sweating, hallucinations, and constipation, only to mention a few. Mode of action. It interrupts the way nerves signal pain between the brain and the body. It inhibits release of nociceptive neurotransmitters, vasopressin, somatostatin, insulin, and glucagon. By inhibiting release of nociceptive neurotransmitters, it is inhibiting transmission of impulse between neurons. N-type voltage operated calcium channels are closed and calcium dependent channels are opened, inwardly rectifying potassium channel. As a result, there is hyperpolarization and reduced neural excitability. Hyperpolarization is the inhibition of action potentials, and neural excitability means that the cells on the neurons will no longer be affected by the stimuli, and therefore no impulse is produced. Administration route of pethidine. It can be administered orally if it's a tablet or a syrup. It can be injected into the patient, like subcutaneous, intramuscular, intravenous. Subcutaneous, it is injected beneath the skin. Intramuscular, it is injected into the muscle. Intravenously, it is injected into the vein. How is it used in radiography? It is used as an analgesia and a sedative because it produces calmness or sleep, and it relieves pain. So, for example, it is used in cineradiography. In cineradiography, there is a radiographs of moving objects such as the heart and joints. It is also used in renography, where They want to produce radiographs and they have access to the structure and function of the kidneys. Then in interventional radiology, for example, in intravascular ultrasound, where they're using invasive techniques to diagnose or treat diseases. This marks the end of my presentation. Thank you.